Surgery for pain relief. This is something nobody wants to talk about. Surgery for pain relief. Well, this is something nobody wants to talk about. Surgery for pain relief is a big business. The industry goes for hundreds of billions of dollars worldwide, and very few people will tackle this issue because they didn't want to get into controversies. Hi, I'm physical therapist for last 33 years, and my name is Subrat Bainipati. Here at Synergy Therapeutic Group, I treat people without medications or injections or surgery for their chronic pain condition. It could be back pain, it could be neck pain, it could be pain in general. In this video, I'm going to talk about not all surgery is bad, but when it comes to a choice, when you are supposed to have surgery and when you are going to avoid surgery. So please watch this video till the end. I create this kind of content just for you. So if you're watching this video, probably you have some kind of pain, maybe a back pain, maybe a neck pain, maybe a shoulder pain, and maybe things are going with you for years, maybe a few months, so whatever that is. And in this video, I'm going to explain it to you step by step that how you're going to make the decision. Because in my 33 years of experience, this is what all the patients, what I have treated or I have seen, they taught me, and they are the one who encouraged me to do this kind of content and video. So if you're new to this channel, please subscribe and also add the bell icon so that you get the notification whenever I upload a video. I try to upload video as much as I can, but sometimes I just don't have time. But I make this for you. So let's dive in deep now. Now, many of you, if you're watching this video, may ask me that, well, the surgery was my last resort. So I have tried everything possible. I took medicine, I went for physical therapy, because this is usually the standard thinking. So I went to a chiropractic care, I did massage, nothing really worked. So surgery was my last resort. This is why I broke down and had my surgery, or nothing really worked. So I am thinking surgery is my last resort, and that is exactly what I am about to do, because I'm going to schedule for surgery or something like that. And this video, I'm going to explain it to you that why the conservative treatment did not work for you, and why the surgery, you may think it is a last resort, but why it is a bad idea. So before we get into all these things, we need to understand basic two things. Because you are thinking of pain, and I understand pain is the most measurable symptom what we experience. Pain is not good. Pain creates a lot of fear. Pain thinks what's going on with us. So yes, I understand pain is a problem. And that is the pain is the one which you are trying to fix. Okay, so let's talk about pain in the beginning. So basically we can divide pain into two categories. One called as the acute pain and one called as a chronic pain. So acute pain is when your pain starts suddenly. So pain starting suddenly does not mean you always have a trauma. For example, you are walking down the street, you got hit by a car, a tree fall on you. Yes, you have a trauma, you have a tissue damage, so you have a cut, broken bone. These are real tissue damage. And this real tissue damage create pain, that is an acute pain. Okay, or something else happens. So you just suddenly feel pain. That's what we call as acute pain. Now, what is chronic pain? The definition is very simple. So when your pain is more than 12 weeks long, it is chronic, period. So your acute pain, which starts immediately, then when your pain lasts more than 12 weeks long, despite of no matter what treatment you did, that became chronic. So by the time you will seek some kind of surgical help or have an appointment to go to a surgeon, it is probably going to be more than 12 weeks. So by that time, you are deeming your pain as chronic already. So surgery, if it is necessary, it is good for your decision-making ability. Surgery is good for acute pain, like for trauma. And trauma means like that time you are not making decision on your own. Somebody else is making decision for you. Like I can tell you, I have one patient. I see him after 6 months, but 6 months before he had an automobile accident. So he had fractured pelvis, broken leg, all this kind of stuff. Yes, he needed surgery. So immediately the EMT, they wrap him up, took him to the hospital, and that time he didn't have a choice. So he's not going to looking for, am I going to have surgery or not surgery? Those are emergency. Yeah, the surgery needs to be done, and done is fine now. So in that kind of cases, yes, surgery is required. So imagine suddenly you have pain, you went to your physician, they did an X-ray, find you have a tumor. Do you need surgery? Yes, you need surgery. But that is only 1% of the population. Only 1%. We will need surgery. But you are hurting for last 6 months, 1 year, 2 years, 5 years. Now you are deciding to stop the pain through surgery. That's exactly what I'm trying to tell you. That is not going to work. If it works for different reasons, I make a lot of video. So you can watch all these videos, subscribing to this channel. Or I have another channel from the company, Synergy Therapeutic Group. You can watch a lot more video on that channel too. But this is Synergy Healing channel, so we talk about a lot of stuff. And also, I have many detailed video. I have a course I have produced called the Synergy Natural Healing. The description is in the link. You can click there. There I take you step by step process that what not only make you understand what you can do to get out of the chronic pain. So not to get diverted from this video, let's talk about the chronic pain and the acute pain. So I told you already that acute pain is the one which started suddenly because it is of a trauma. That time you are not choosing. But chronic pain, which is almost like 98-90% of the time, that time you are making a choice because nothing else works. So you think surgery is a last resort. So if you do the surgery, they are going to fix your pain. But unfortunately, it does not work that way. So to understand that, I will tell you about chronic pain itself. So acute pain is happening because of a real tissue damage. But chronic pain is not happening because of the real tissue damage. It is because your brain's perception, how your brain thinks the sensation it is. So it is not because of a single structure. Like in an acute pain, suppose you fell down, you break your arm. So this, because of a tissue damage, it is a single structure. So when you do an X-ray or MRI, you can see the bone is broken or some damage happened. Once you repair, your pain goes out. But once the pain becomes chronic, you don't have a single structure. Now, many people, they will ask me, then what about the bulging disc, this, that? I am going to make a lot more video about every little detail about that. Or you can watch my other video. Actually, I recorded a whole back pain or a shoulder pain webinar and workshop live recording. You can watch that too. I explain a lot. But my whole point of saying this thing, if you have chronic pain, any pain beyond 12 weeks, this